Hello, and welcome to another episode of the Melbourne Athlete Development Podcast. Today, we're fortunate to have Dr. Chris Gaviglio here with us. So, Chris is from the University of Southern Queensland. Do you want to introduce who you are, Chris, and give us a background of your research and what you're interested in?
Definitely. Thanks for having me on, gentlemen. Great to be here. I'm working at the University of Southern Queensland. My role is I'm a lecturer in strength and conditioning. There's a Master of Strength and Conditioning program that we're in our second year with, and I'm one of the course presenters, course examiners, and creating a lot of content for this online course, which I'm really enjoying. Prior to that, I've been a strength and conditioning coach for over 25 years. And look, at the end of the day, even though I guess I'm theoretically now an academic, I'm still a coach at heart. And I think that's one of the skills I bring into this course is like, you've got all this theoretical knowledge. How can we practically apply it? Because when the rubber meets the road, you need to be able to apply this stuff. So anyway, back to my beginnings is that when I left school, I did sport. I love sport, and I thought I'd try a little bit of this and a little bit of that. And I thought I'd try this thing called strength and conditioning. That was before it really took off as the industry that we have it today. There'd be a couple of coaches who would be in professional clubs. There was no full-time school programs, or there might have been one or two. And personal training was really big, and exercise physiology was in its infancy, in my opinion. And so consequently, it's very hard to get a full-time job. And I remember working 4 or 5 different jobs just to earn money, did some sport, really loved the S&C. And then eventually I got my first full-time role overseas, actually, in Bath Rugby in the UK. And that kind of let me on this journey where it was like this melting pot at the time leading up to the London Olympics as well, which was coincidental. And we had the UK was spending all this money bringing in sports scientists, top S&C coaches, and being a small country, you can get together, go to small conferences. And I was quite lucky at the time. There's this gentleman called Professor Christian Cook. And if anyone's into any kind of academic readings, he has produced hundreds of applied sports science articles and has really formed what became my research. And just, from things around the use of salivary hormones as a marker of competition and readiness, which is what my PhD was about, through to the role of hormonal priming, probably one of the first persons to really coin that term, and all the way through to things like passive heat maintenance, which is we warm up. The reason why we warm up is not only to get us ready for the skill, but it's also to increase our muscle temperature. Now, muscle temperature, for every degree change in muscle temp, we have I think it's about 6 to 8% changes in potential power output. So we warm up, we have this huge potential to increase our power output from a muscular point of view. And then as we cool down, and just implementing simple things like wearing passive heat maintenance jackets. So you think about those silver insulation things you wrap around you when you go hiking, or the roof insulation that goes into your ceiling. And consequently formed my thoughts. So I went to Bath, met this guy, Christian, and then at the same time got involved with some UK sport projects working with skeleton athletes, and then eventually with some salivary hormone analysis. And we just looked at the effects of training, or what would happen with salivary testosterone and cortisol around training and competition. Was there any relationship? And it was really interesting at the time. Midweek, we'd have this thing called a stress test, and you'd start off, and what's our response to a session? Now, ideally, when we think about rugby union players and most athletes, we want this anabolic response, really important. We had this really nice rise. So if we would have a positive response to a session, we would have higher testosterone concentrations on the weekend. We would win. It was chalk and cheese. It was chalk and cheese. Like if we had no response, we would lose on the weekend. And we found this 2 years in a row. There was all this other stuff that we found as well. And so from there, that then led on to, if anyone's lived in the UK, is eventually you get sick of not having enough sunlight. And I've got lots of friends over there, and I'm sure they'd attest to that as well. And it was time to come home. Came home and then still worked in sport, AFL, Gold Coast Suns in the first 3 years. And you boys are from Melbourne, so don't judge me on that. But it was fantastic. You know, a lot of the stars that we have today, and you're laughing. But, you know, it was great coming into a different sport with, like, you know, no knowledge of AFL at the time. And like everything when I coach, is it doesn't matter what sport it is, it's the people that I get to form relationships with that I really love. And that's what kept me interested in the sport. You know, as time progressed, back to Queensland Academy of Sport, working with Olympic-based athletes. And within that time, up to where we are now, yeah, Maroons there for 5 years. That was quite nice to refreshing, is to go into that camp-based scenario with the Maroons State of Origin team, and then after that Broncos for a little bit, and then into where I am now full-time as an academic. But I actually still do some coaching as well. So I work with one athlete, his Olympian decathlete, Cedric Dubler, and I've done some fantastic little side projects there as well. So I keep pretty busy on top of the BFR as well. So, and in the UK is when I actually first got introduced to this thing called blood flow restriction.
I was going to ask, what's the story behind your exposure to blood flow? Because you've obviously got BFR Radio, the podcast. It's something that you are very well versed in, and I'm assuming you use a lot clinically. What's your exposure to it, and how did you get introduced to it?
Yeah, well, when I was in the UK, this gentleman, Christian Cook, and when I first got introduced to BFR, it's not like it is today. There's multiple companies with different forms of BFR, from the automated systems through to the pneumatic systems like mine, through to practical BFR, where you could they incorporate into the garments, and all the way through to, well, if you've got no money, you use knee straps and you wrap them around to an RP of 7 out of 10. And when you look at this academically, all of them are shown to be really effective in terms of an intervention or type of intervention. So anyway, Christian just threw me this thing, and it was actually an army pneumatic tourniquet. So it was slack, pump, no gauge, you inflate it. I said, what do you know about this? I knew nothing. So I went to literature, and there wasn't a lot on it. And when you look at historically about BFR, it actually originated from Japan, Katsu, in the 1960s. And there's actually a lot of research, and they are the OG in terms of that world. And BFR is, I guess, a bit like the academic, stemmed from that. This, you know, they started studying academically. They call it blood flow restriction. If you read into the world of Katsu, they actually don't like the word blood flow restriction, because theoretically you're not supposed to be restricting blood flow, but rather moderating the blood flow. Anyway, so he threw this to me, and look, at the time it was pretty crude. It was an absolute pressure that we inflated it to 140 mils of mercury, because a couple of papers said around this number. And I remember the first person that we used it on was a South African rugby union player, 10, Butch James. If you're into your rugby, very infamous player. And he had had a history of ACLs. He'd had 4 ACLs surgeries, reconstructions, 2 on each knee, and did his 5th. And the World Cup's coming up. And so we thought, well, let's give it a go. And as per usual, the medical staff said, what evidence have you got behind it? And I said, well, this is the evidence here. There wasn't a lot. And consequently, it was a simple protocol. We just trained with it on. And I just still remember is that he said, these are the biggest quads I've ever owned, which is pretty cool. Yeah, long story short, went to the World Cup, played for many years after that. We used it on another athlete who had an ACL. And then, as I said, I came back to Australia, and I remember that one of the physios said, where'd you get this BFR cuff from? We're really interested. And you went on the internet at the time, and there was actually, you couldn't actually go and buy a BFR cuff for training. You'd actually had to get it from like a medical supply place. And then I I'd actually produced another product before this. It was a thoracic wedge, type of a rubber type product. And so I've always had this entrepreneurial mind. I like to create things, and I thought, well, hey, maybe there's a industry here. As we fast forward now, there's a huge industry with BFR, and found a buyer in China where you could. I contacted him, someone who knew someone, and said, "This is what I'm interested in." And the product has consequently evolved over the years. And at the time, there was a huge gap in the market, and I could see some positive effects for it. And I've just stuck with it. My core business was still S&C, and at the time is, well, I'll put a website together, and then I started to realize that on top of that is demystifying that there's a lot of, I guess, I don't know if scared's the right word, but we need to educate people about how to use it, because like everything, when something's used properly, it's safe. It's when you abuse it, and even just strength training. You get someone with no weight training experience, and you give them a German volume 10 by 10 squat session, you're going to cause a bit of damage. Same with BFR. If you know how to use it wisely, systematically, introduce it into their training, and remember that a lot of people will read an academic journal and go, well, that's what we've got to do. We've got to do that. Well, that's for academia. They have to have strict controls around how they put together a project. So, but in the real world, if you have a 75-year-old lady who comes in with no history of exercise, and then you say to them, might have some knee osteoarthritis, and we want to do some work for their quads, and we say, oh, BFR is great, and I read the 75 rep protocol. Imagine saying a 75-year-old with no training experience, you have to do 30 repetitions and 3 sets of 15. I don't know about you, but even me at my age, I'm not interested in 30 repetitions. So it's been able to take this literature and being able to be sensible with it and put our coaching hat on and go, well, what are we truly trying to achieve when we use BFR? And consequently, so I said, well, I think we need to educate people as well. Hence the podcast, the idea was BFR radio is to look at literature, to demystify it, and to actually give my experiences, and then bring other people on the podcast as well, because as with your podcast, the stories that people tell are just so powerful and invaluable that we need to get those stories out there. So hence the podcast as well, to help educate people.
Can you, so that we start to elaborate on exactly what blood flow restriction or Katsu training does, can you start to explain some of the mechanisms, some of the physiology of what's going on there? Because for people wanting to know exactly what it does, it's probably good to get an idea of what it actually does at the physiological level, and then we can see how that might be implemented.
Yeah, definitely. And when you dig into this is a massive area. So if anyone's about to listen to this and they're going to fall asleep, I'll try to explain it nice and clearly for you, and try break it down as well. And there's a lot of mechanisms that are involved with
Well, I think that's
BFR.
the interesting thing, is that it's not just one mechanism, and that's what's cool about it, which it seems like a very simplistic thing to do, which is, restrict using some sort of pressure around the limb particularly. And it can have such effects, which is quite interesting in itself, that something seemingly so simple does seem to have a varied and complex interaction with, especially when it's combined with training.
Yeah, so I'll go into it, and we'll probably talk about low intensity strength training first. Is probably a great way, because everyone understands, well, firstly, BFR, what we're doing is we're partially restricting blood flow, and you'll put it either on the upper arm, on the bicep, or on the top part of the thigh, either the arm or the legs only. And we inflate this to a percentage of our arterial occlusion pressure or limb occlusion pressure. So if we go 100% of arterial occlusion pressure, that is how much pressure is required around a limb to totally stop blood flow. But we don't want to totally stop blood flow, or we don't want to totally restrict. We want to partially restrict. And if we look towards literature, they talk around this 50 to 80% of arterial occlusion pressure. And you can calculate this in several different ways. You can use a Doppler ultrasound, which you can get your ultrasound, increase the pressure. Once the pulse goes, that's full occlusion pressure. There's some really great equations that take into consideration limb circumference and blood pressures as well. And that's been shown even in the surgical fields to be just as effective as Doppler ultrasound. And then you have that practical BFR for those people who can't afford cuffs, but they want to just use some knee wraps. And once again, that's 7 out of 10. RP of 7 out of 10 has been shown to be effective in literature. And we have this pressure, and therefore BFR is really individualized. And that's something to take out of this as well, is the pressure that I have is different than someone else who has a much smaller limb. And the practicalities of being a coach, of training age and experience and so forth. So what we do is we inflate the cuff to our set pressure, and then what we're doing is we're allowing the blood to flow into the muscle. That's arterial blood flow, but we're going to restrict it coming back out, or in other words, restricting the venous return of the blood flow. And what happens here is we're training, we have this feeling of fullness, you get this what we call the pump, and then as we have a slight pooling of blood, we have this concentration of metabolites that are in our blood. And then because we're restricting blood flow, the oxygen is in the blood. So it creates a low oxygen environment. So it's a localized hypoxic environment as opposed to systemic when we're in altitude chambers. And this hypoxic environment creates metabolic stress. And one way I try to explain it is that our body requires stress to activate different pathways and signaling pathways to create the responses that we want. In the gym is a great example. We need at least 70% of our 1RM on our back or on our body lifting weights, and that is mechanical stress. Now, this mechanical stress activates all these pathways, or I say like flicks on all these switches that gives us all these wonderful responses, and we adapt, we get faster, we get stronger, we hypertrophy. What this does with this concentration of metabolites increases metabolic stress, and that term is being thrown around a lot with BFR. We're increasing metabolic stress, and that's why there's lots of repetitions, especially at low. They talk about 30 reps. Well, how are you going to achieve increase in metabolites, that feeling of fullness? Well, 30 reps is going to do it. But for some people, it could be 15 as well. So something to consider there. And then as we're training, we're getting really full. The body starts producing lactate. And we always think, oh, lactate's this nasty word. But lactate can actually regulate different metabolic processes. And it's actually important in long-term structural adaptations as well. So we have this concentration of metabolites. That's mechanism number one. And this lactate is they sometimes term it as like a pseudo hormone, which can, as we said, increase this activation of these different pathways. Another mechanism is anabolic hormones as well. So if we can increase testosterone, growth hormone, insulin growth factor 1 naturally within our body, that's been shown to have adaptive responses with increases in muscular strength and muscular size as well. So that's a really big tick as well, anabolic hormones. Then we have intramuscular signaling, and this is independent of the hormones and the growth factors. And this is things called mTOR and heat shock proteins. And once again, these are just markers. If we increase mTOR or heat shock proteins in our body, the adaptive processes increase muscle size and strength. Interestingly, heat shock proteins can also be activated with heat. So that's why saunas post strength training is a fantastic tool to be using to help maximize our strength gains. Anyway, then we have intracellular signaling, and then this is like the intracellular signaling. That's kind of talking about the pumps. We get this pump when we're training. We feel really full, And there's this signaling response from the body that the cell is being threatened. They think, oh, something's going wrong. So as a result of this, there's this other pathway activation of other anabolic pathways that has this positive muscle physiology. And there's also muscle fiber recruitment. We have low oxygen environment. Our low threshold type 1 motor units, they fatigue early, and therefore our type 2 fibers have to take over and have to be activated. So therefore, at low intensities, we're now able to activate our type 2 fast twitch fibers. So they're our main 5 when you look towards literature as to how BFR can assist in these changes that we see.
When you think of muscle hypertrophy specifically, there's obviously argument about what particular things drive hypertrophy. And the big ones that you actually just mentioned, the mechanical tension being one, metabolic stress, and then muscle damage is the other one. But I know some people suggest that ultimately the biggest factor that leads to hypertrophy is mechanical tension of your fast twitch fibers. And as you mentioned, then with blood flow restriction training, because you're going to create more fatigue more quickly, you're more likely to recruit those fast twitch fibers, even when you're doing low intensity. Do you believe this to be the main mechanism that helps a hypertrophy with blood flow restriction, or do you think actually metabolic stress itself is a unique anabolic signal to maximize hypertrophy?
I think it's really difficult to pin it on one thing. It's the increase. Yeah, but at the end of the day, you need the metabolic stress to activate these different signaling pathways, whether it's intramuscular, intracellular, and so forth. If you trained low intensity without the cuffs on, we don't get these same responses and we don't get the same adaptations. Therefore, it's only with the addition of the cuff that increases the metabolic stress. But it's not the one thing. It's like, if you have the right intensity, I've found with athletes, I was actually able to do a little bit of basic hormonal analysis using cuffs, and the intensity has to be high. And in athletes, in Gen Pop, we talk about 20 to 30% of 1 RM. That's what we need in terms of the loading with the addition of BFR. My gut feel is that in elite athletes that we need higher percentages as a bare minimum, like 40, 50%, because these are well-trained athletes and they need big amounts of intensity to make these, to activate these different pathways, I guess we could say. So, well, yeah, you need the metabolic stress. You need stress in the system. I kind of look at it as my basic analogy is I've got a cup here. At the moment, it's up pretty high. This is my high intensity work. If the stress is really low in terms of the loading on the bar, how am I going to get this? And the only way I'm going to get that is through metabolic stress.
You mentioned there the hormonal effects. And I know early on, it piqued my interest when you were saying there was a difference in the performance of the rugby team depending on whether you had a more positive testosterone response from the training application versus a lower response. And I know there seems to be some link between the behavior of testosterone and cortisol as they sort of interact with each other. Can you explain sort of what happens with that hormonal response in relation to, say, blood flow restriction training and how you would even look to create specific changes in that hormonal response?
So did you want to go down like the technical pathways
Yeah,
there?
go for it. Yeah, that would be great.
So probably one thing. So testosterone, for example, is typically associated with increased protein synthesis. So the ability for, if we increase protein synthesis, we increase the onshoot of that is increase in muscle size and strength. There's also other things such as growth hormone and insulin growth factor. If you look at the pathways, typically there's a delay between insulin growth factor and growth hormone. And my understanding is we have the growth hormone gets activated, and then as an onshoot of that, we see increases in insulin growth factor 1 concentrations. And we'll talk about IGF-1, for example. So when we look at increase in hormone concentrations, such as IGF-1, if I just go back to testosterone for a sec. So if we increase our testosterone concentrations, so not only is that being associated with protein synthesis, but as you alluded to, we look at the behaviors associated with it. So when you look at some other research, if we increase testosterone concentrations, we increase behaviors such as aggression, but in case of just athletes in a day-to-day scenario, determination. And in some studies, I've actually looked at increased testosterone concentrations has related to the ability to do more work, or in other words, they put more load on the bar. So if we're putting more load on the bar, we're increasing the total stress on the system, and the body adapts to that stress. And this is in a non-BFR scenario. Therefore, the total accumulative stress that you put your body under over a long period of time, longitudinally, increases. And then if you think about, we take this into this BFR scenario, is that we're able to activate these different pathways. So testosterone, not only does you go from, if you've ever done BFR work, I just feel fantastic when I do it. So I feel great. I decrease my joint and tendon pain, which is another really positive side effect. Well, not would say side effect, but a positive onshoot of using BFR. So people have sore joints is that they can use it, decrease joint pain. They feel that muscle activation. They feel it working. So all of a sudden that's that mind-body connection, that the program that they're doing is working. And they end up doing lots of repetitions. So typically they wouldn't have done. And then there's other pathways associated with the decrease in pain. And then one way to know is, have we got enough stimulus in our body? We could think about that as the marker, is that we have increases in these hormones. So whether it's testosterone, insulin growth factor, growth hormone.
Have you found that there's certain prescriptions of the BFR that tend to have a greater effect? I know you said you sort of started to play with seeing what hormone responses happened with some of these elite athletes when you did implement the BFR training and then measure those factors.
Yeah, so it's whether we want to go low load or high load, and we'll probably talk about some high load BFR later on.
Did that seem to have a greater effect?
So hormonally, I haven't been able to measure high load training. So if we could talk about that if you want. So if we look at high load training, that's typically not really well looked at. You know, people will kind of frown and say, well, aren't you supposed to be using 20 to 30% of your 1RM? And if we think about, once again, we go back to the cup analogy, the stress is really high. So in our low load training, the load is low. We need to fill the cup up full of lots of other stress, in this case, metabolic stress. Therefore, we need lots and lots of repetitions, and we need a continuous pressure. For the upper body, 15 minutes continuous. For the lower body, 20 minutes continuous. And just on a side note on that, if you're doing a lower body session, and let's just say, well, hang on, my session goes for 40 minutes. Chris said only 20 minutes. What you do is you might do your first exercise, might be bilateral back squat, do your squats. You have it for a total of 20 minutes if you can handle that. And then you finish that exercise. If you're doing low load BFR, the sessions are really quick. Decrease the pressure a little bit, take the weights, unpack the weights, set your next exercise up, reinflate, away you go. Therefore, you have, I lost my train of thought there for a little bit, but you have this low load BFR, lots of repetition, continuous. And then you go to high load BFR, and that's where the stress, we have our cup, the stress is pretty full already. We only need a little bit of stress on top of that. So we would use what we call an intermittent protocol, where we inflate it for the set and decrease it during our rest periods.
Yeah, interesting. Okay.
Now, now the positive effect with high load BFR, and everyone says, well, isn't that dangerous? Well, when you look towards literature, there's been no negative side effects. Nothing's been studied in terms of hormones, but barbell velocity has been studied. And they've actually shown that barbell velocity with wearing the cuffs increases barbell velocity than without. And they seem to think
Is that you mean in the moment, or are you saying over time?
In the moment, so acutely.
Why do you personally think that is, even if it's you
It
might
seems
have the mechanism?
counterintuitive,
Yeah,
yeah.
you would think that it would make it more difficult, for instance, in the moment, just because of the occlusion itself.
Yeah, when you're quite used to the occlusion, you get your head around it. It's surprisingly how heavy you can go with them on, but you can't do it continuously. It's really tough. This is a bit of a hypothesis and a bit of what I've read. So the authors suggest that having the cuff material gives some kind of mechanical advantage. Not mechanical as in load, but actual mechanical advantage to that limb. And I do wonder if you're changing the tension within the muscle and also the length
Compartmental
of
pressure, you would think, actually, to give the muscle a mechanical advantage. Yeah,
and also then changing the length of the ligaments or the musculotendinous area as well. We think about like a Gilmore's groin strap, for example, where people have groin pain. We widen that point where it inserts proximally up near the hip to decrease pain, and we're lengthening that whole area. So does that change some kind of fascial tension within the muscle tissue that
I was going to say that, Chris.
an
Yeah,
advantage?
well, I was just going to say, because like the increase in compartmental pressure would cause more stiffening of the aponeurotic fascia, where a lot of the muscle fascicles actually originate from. So you've got a more stable platform for muscle contraction.
Yeah, it's you kind of start thinking, go, hey, maybe there's something there. And then when we look towards velocity-based training, if we can train longitudinally at the same loads with higher velocities,
it's going to have a cumulative effect.
100%. And therefore, I've gone off onto my little tangent. I've actually trained like that. And now, as I'm aging, is that I don't have the ability to maintain the same levels of strength as I did 20 odd years ago. And I'm definitely decreasing in my ability to do a 1RM. But I definitely got back to my previous 1RM that I hadn't done in over a year. So, and then consequently with select athletes, and this is select athletes only, would I go that, hey, look, we need to maximize barbell velocity. And that's pretty much all athletes really, isn't it? And then the cool thing with that is that once again, when you're working with athletes who are sore, tired, or have little niggles, if you start with a warm-up protocol that you put the weight on the bar and you get them going, you get warmed up a little bit quicker as well, which is quite nice. You're decreasing joint and tendon pain if they have anything. They have this nice feeling of this activation in the musculature. They've got that awareness as well that everything's feeling really good. And then they just keep increasing the loads, going from a continuous low load pressure during the warm up to this intermittent high load pressure. And the cool thing
Can I ask?
Yeah.
I'm sorry. No. I was just going to say, can I ask, with playing with that, you mentioned obviously changing that potentially compartmental pressure and the effect that has on velocities. Have you tried it in tasks outside of the gym? I know obviously you said you work with athletes across different sports, including the decathlon more currently. Have you tried, using some sort of compressional type material or to actually get them to do, running, jumping, something like that, and seen any changes in their, capabilities in those tasks as well?
Yeah. Jumping's really difficult to be able to express maximal ballistic power or muscular power is really difficult with the cuffs on. Therefore, I tend to decrease the pressure. At running, yes, definitely. We've got athletes to run with it on. It's hard to run maximally with them on. It's more your tempo type work that you would you would look at doing it. And I do know a couple of AFL clubs have been using it as kind of tempo type running as well. And then also there's actually some really cool research as well with elite rowers, where you kind of think about, you know, they do all this this low intensity in rowing, you know, around 2 millimole per liter of lactate. So it's all just that low intensity aerobic work that they do that's more regenerative, and it's good to revisit that aerobic base, that zone 1 around zone 2. But could you maximize your low intensity work to get a better physiological benefit? And in a rowing study, they actually 20-minute sessions, just 2 times a week in elite rowers, actually had improvements in VO2. No improvements in strength, but they were all doing strength training at the same time. So there's definitely scope to do that, and definitely in different skills like small-sided games as well. You could make it quite difficult. You think about also in boxes, for example, you need to do, you know, how can you increase the difficulty of what you're trying to achieve physiologically during a session as well, wrestling as well. So being able to mimic movements, increasing lactate, working for when they get to the situation in a competition specific scenario, that they've actually been able to go to an extreme level of physiological stress, and they know how to handle that, and they know how to recover from that. And if you're training and you can achieve that and you adapt to it, you know, theoretically we have a better athlete at the end of the day.
On that, when you say like you're implementing these things, what are the sort of considerations you need to have? Because you mentioned obviously it's a high metabolic stress, and our interactions with using things like BFR and my interactions with it has been that initially people actually do find it quite taxing, particularly in, say, preceding sessions, even if they're not using it. So do you have to kind of be careful with how you implement it and make sure that you're gradual and graduating that in, you know, in a progressive fashion? Because have you noticed that some people do have different adaptation curves to actually using it and having that type of metabolic stress?
Yeah, exactly right. It's good coaching principles really come into play from a simplistic point of view. There's people that enjoy it and the people that actually don't enjoy it, and you've got to understand how to construct it within those constraints. And if you truly believe that it's a positive tool, it becomes as much as an educational process as it is as an implementation. So if you came to me the very first time of using BFR, rather than saying, well, literature tells me that I need to pump it up to 80% of arterial occlusion. This depends also on the cuff width as well. There's different products out there. The thinner the cuff, we have thin cuffs from around 5 centimeters to 10 to 15. So I should say the wider the cuff, put it the other way, is we're able to spread the amount of occlusive pressure over a greater area. So we use a lower percentage. So we use
Yeah,
like
we found the same
50%.
thing. Yeah. We found that
Yeah,
people, especially in a clinical setting, obviously as physios, we find that when we use it, and we'll probably get onto this about injury, because I know you've done a lot of really cool work in that space as well, but we find that if you're using the wider cuffs, you do have to start a little bit lower, because even just the perception and the feel that they get is much firmer if you use even a similar amount of pressure with a wider cuff compared to a narrow or a thinner cuff.
Yeah, exactly. And that's why individualization is very important. Firstly, you need to take the client or the athlete or whomever into consideration. As a basic rule, the bigger the circumference of the limb, the greater the total limb occlusion pressure. Then the 50 to 80% comes into play also with the cuff material and the cuff width. If we have a wider cuff, we can go 50%. Then what we would do is we'd calculate the pressure. Now, the very first time that you would come to me, I'd actually drop it by 20 mils of mercury. So let's just say, for example, I calculate you at 160. I'd inflate it at 140, and that's what we would train at for a couple of weeks. And I'd also then build the tolerance to the cuff, because I'm a big believer that I know it's going to work. But I want you to have a really positive experience. So once again, it's like we take the German 10 by 10 squat program. First session in, I'm not going to give you 10 by 10. We're going to do 2 or 3 sets of 10. We're going to take time in between the sets. We're going to look at your technique. I'm going to ask you how you're feeling. I'm going to see how you respond in a couple of days' time. And I take that same kind of principles into the BFR as well. We inflate it. I get you to walk around. We deflate it, talk a little bit more. And then what we will do is increase the total occlusion pressure time or restrictive pressure time up to that 20 minutes over a period of up to 2 weeks. And depending on the person, it might even be a little bit longer just because they just can't handle it. And then also, if you drop by 20 mils of mercury, it gives you a little bit of room to play with, because if they turn around and they go, actually, that pressure it's like a 8 out of 10. It's still a good pressure because it's a recommendation. This 50 to 80% is a recommendation. Now, there's a couple of really cool cross checks that I actually do. One is skin color. So dark reddish color is good. If it's purple or blue, too tight. The other one's capillary refill time. Yeah, capillary refill time is another one. So we have this nice dark reddish color. If on our upper body, we have the big meaty bit under our thumb on our palm, or on our quad, we have our VMO, that nice teardrop. And what we do is we push our thumb into it, and then that color goes out of our skin. And then we're looking at how quickly our capillaries refill, and it's capillary refill time. And we're looking for around 3 to 4 seconds. If it's 6 seconds or longer, as we could imagine, it's too tight. Blood can't get into that extremity to refill in the capillaries. And they're my real simple cross checks. I ask them how it's feeling. I look at skin color. I do capillary refill time. And then the other thing which is really good, and this doesn't appear in the BFR literature, this appears in the Katsu world. And they do this thing called Katsu Joatsu, Joatsu. So it's basically, think about it as an incremental warm-up protocol. If we're training at 140 mils of mercury, what we would do is we'd go 4 incremental. So we'd start, inflate to say 100, hold that for 40 seconds, decrease for 20, and then go 100, 110, 120, 130, and we inflate to 140. And what that does is it prepares the vasculature for the upcoming compression that's going to be created by our training pressure. It's like a good warm-up. We don't just get hard into our first set. We do a couple of warm-up sets. And I've definitely found for those people that have never done it before is, once again, we calculate theoretically you should be training at 140. Let's just inflate it to 100. And I'm asking the same questions. How's it feel? Feel okay? Okay, good. Let's just go for a little walk. Let's decrease the pressure. Inflate. Talking to them the whole time. And then once again, that first session. So right, it's time to do our session now. And what we're going to do is we might just do 2 sets with it on, inflated continuously, just so they feel that feeling of fullness and they can get the effects. Because usually by that second set, they can feel the limbs getting tired, feel the muscles getting full. And you say, well, that's really great. That's that increase in metabolites, and that's going to really help activate all these different pathways, which is going to get the changes that we want. And I'm asking, like, how's the joints feel? How's if let's say they have a little bit of patellar tendonitis, actually, you know what? It feels really good. And, how's it feel through the knee joint? Oh, it feels really supportive and warm. Fantastic. Right, we're just going to decrease it. We'll inflate it for set number 3 and number 4. And that's going to be it for today. And then I'll say, we'll check in 2 days' time just to see how it went. And especially for those people who are like, I'm not quite sure. It just gives them time just to settle into it and just to understand what their response is. And as a practitioner, it makes sure that you don't tip them over the edge that very first session.
You've given a few examples, Chris, of the utilization of BFR in high performance, because I feel like traditionally BFR is thought to be used for elderly people who can't do high intensity type of training, or from a rehabilitation perspective. Now, in terms of its application in high performance, do you see it as potentially being superior to other forms of resistance training, or do you see it more as a way to create different types of stresses to the body? Because as you mentioned before, it's like we can get accumulation of different stresses from different types of stimulus, like metabolic versus mechanical tension. Do you see it more from that standpoint, as in it's just stressing the body in other ways to allow maximize adaptation?
I think about it as a tool in the toolbox. It's a very good tool. There's going to be responders and non-responders. In terms of, at the end of the day, if you're a strength, speed, power athlete, there's no substitute for load or no substitute for mechanical stress. Load on the bar is still going to be superior. So I don't want everyone to listen to this and go, oh, we can now lift at 30% of 1RM. Happy days, we're going to get increases in this, and this, and we're sweet. You don't have to lift heavy anyway. If you're a strength, speed, power athlete, you need to still lift non-BFR and go there. But you can use this tool wisely in a multitude of ways for high-performing athletes to maximize your benefit. Earlier on, I spoke about, so I'm going to talk about two things. One is how we can use it actively and also then passively. So we'll just expand a little bit more actively on how you could use it. Warm-ups, you get them coming in. How can we ensure that you have warmed up appropriately? If you have athletes football players, probably a great example, they always have a niggle. I remember working in the state of origin. I got two really good examples, but one of the players was doing rotator cuff work like that. And I said, well, what are you doing that? Just chatting to them. I said, well, the physio wants me to do it. It still really hurts. And so I said, well, let's put the cuff on. And so same thing, away he goes, same exercise, same repetitions, same resistance, because it's only a light band. And then he can feel all the muscles getting activated, feeling full, and the pain decreases, as I've alluded to a few times. And I think this is this little secret power about BFR. Decreases joint and tendon pain, whereas, wow, my shoulder pain has gone. Same with Achilles. We had another player wake up in the morning looking like an old man, and we put the cuffs on the thigh still, and he would just do some double leg calf raises. And we'd walk 10 meters, 5 meters out, 5 meters back, do a little isometric body weight hold for 30 seconds each leg, repeat twice through, and then he goes, well, he's now not limping. He's walking normally. So he sets his day up really nicely. If you get an athlete coming in, how can we ensure that we maximize our warm-up? Now, it's not to say that you can actually cut your warm-up time down considerably, but what it does do is ensures that when you warm up, you're ready to go. Everything's activated. If we're decreasing pain, we're actually able to ensure that our movements are much more efficient and effective. Then we start thinking about hormonally, is that if we have the right stimulus, if we can increase or maximize our hormonal position of that point in time, well, that's going to help us for the session that we do. So if we increase our anabolic hormones pre-session, we hormonally prime our body, we are more likely to put a bit more weight on the bar, train a bit harder, sprint a bit faster, go a little bit longer and harder, which longitudinally, that's going to help us out. So we can use it there. And I alluded to also for those people is that we can start thinking about, can we use it in high load training? And where I like it with this is that if you have athletes who still need to lift a bit of load, but they can't. So I'll take myself for an example. I have one knee, which it's degenerative. I can't put high loads through one knee, but I can still lift. And okay, so I have a ceiling. Therefore, I think for athletes, we still need to look beyond that 30% of 1RM. We can lift them heavy, but we don't have to go that extra. We don't have to be searching for that last 5 kilos, that last 2 kilos. And when we think about even short turnarounds in the gym, we want to have one session for the week. So you're playing on a Sunday, and then we've got a Friday night game. We say, right, we've got a 40-minute gym session. We've got one for the week. People are reluctant to put any load on the bar because it's like, oh, well, I'm playing in a few days' time, and they get a little bit scared. You can put the cuffs on. You still say, no, we still need 70% of RM, but you can maximize that really short session as opposed to, traditionally it's like, well, we need to get a little bit more on the bar. So that's it actively. Passively is a really interesting concept. So when we use it passively, it's this concept called ischemic preconditioning. Now, pretty cool history behind it. So, well, it's ischemic preconditioning. Essentially, what that is that we're inflating and they're reperfusing, or we're decreasing the pressure. And it's just multiple repetitions that we inflate for a period of time, deflate, and we do that 4 or 5 times. And this originated in the medical field. This is really pretty cool, is that it can create cardio protection. So it can actually help protect the heart during sustained ischemia. Now, ischemia is low oxygen. So, for example, people pre-infarction angina, so people with heart problems, it can help reduce ischemia from these episodes. And also in neuroprotection as well is quite interesting. And there's some cognitive effects, which I could talk about a little bit if you want to. But has been
go for
shown
it.
to
That'd be great.
reduce severity of strokes. Yeah, well, actually, we'll go to that. So if you look towards literature, there's actually some really cool papers on increased cognitive function. And most of these people aren't elite athletes, but they have certain tests that they do. And they definitely find that by using BFR is acutely that their ability to do these cognitive tasks are improved, ability to multitask. They talk about decreasing
Are they doing
brain
that actively or passively?
Oh, so in the cognitive one, they're doing something actively. So they'll actually go and do a session with them on as well.
Yep.
So yeah, we've kind of jumped a little bit there. We'll come to cognitive in a little bit. How about that? We'll keep talking about the ischemic if you want, and then we'll get into
one
to
of
the
the
cognitive.
areas, because we're conscious of time, one of the things that we'd probably want to get into, which I think you've got some good experience with, is in injury. And you mentioned obviously things like the rotator cuff for the rugby player and the Achilles tendon. Do you want to describe a little bit about some of the protocols of the prescription that you use with people in relation to injury, and how you maybe work alongside some of the, your colleagues in some of your previous positions from the medical side of things, to make sure that you can maximize on their recovery?
Yeah, definitely. So in that acute injury phase, it's low intensity, and we all know that. And that's the problem, is that when you're injured, is that you need some form of stress on the system to create the pathway, all the different activations to create the changes. And my best example is Cedric, is that grade 2 hamstring, 3 weeks out from the Olympic Games in Tokyo. And within 12 days, we were able to get him running at 95% over 60 meters. And so this guy runs like a 10.7 for the 100, 7.80 in the long jump. So he's quick and powerful, elite athlete, and did a whole heap of tests. And then within 3 weeks, he's at the decathlon competing against the best in the world. And his performance was not much off what he would normally do anyway, considering that typically we'd have a 6-week rehab program. Now, because it's low intensity, what we're trying to do is we're trying to maximize these different pathway activations with our athletes. Low intensity, and they're really quick and short. So therefore, I'm just looking at maximizing these pathway activations as often as I can. So I'm looking towards upper. So if someone's done a hamstring, well, what can you do? Well, you've got one good lower body limb, and you've got 2 good upper body limbs. That's where we can create some more intensity and create the work, because in those first couple of days, that limb, we're not doing too much with it. Put the upper body cuffs on, and we're doing 10-minute sessions, really high intensity, getting lots of repetitions, feeling full, feeling like, oh, my arms are going to burst. So we're hopefully ticking all our boxes, because we're increasing metabolic stress as much as all these metabolites as much as we can. Our lower body, well, we can go as hard as we want as long as we can be mobile in the gym, because there's a contralateral strength training effect. And that's we know that exists without BFR, but there's actually a really cool BFR effect with it on. So we have both cuffs on in the gym. We have them on both legs. Our right leg, which we've injured, it's just sitting there. We might be doing some light body weight stuff, but our left leg, what can we do? Single leg press, Smith machine. We're doing a single leg squat. We are just not going super heavy because it's probably a little bit hard to manage our body, but we're able to push as much load and as much repetitions as we can. So I'm looking at hitting this multiple times in the day, 2 upper body sessions, a lower body session. I'm looking at some passive work, which we didn't really go into, but there's great evidence around this ischemic preconditioning passive work at night time. So doing protocols of 4 by 5 minutes daily at slightly higher pressures. But what that has been shown to do is increasing our muscle oxidative capacity and also our resting muscle oxygen consumption. So if we think about at rest, our muscles use oxygen. So if we can reduce our rest and muscle oxygen consumption, well, our muscles are a little bit more efficient, and it's easier for our body to recover as well. Whereas the oxidative recovery kinetics, that's the process where, once again, it's a recovery process. So we're just becoming a lot more efficient in how we recover from our sessions. And so at the end of the day, he's there. We've done 2 upper body sessions. We've done a lower body session. He's put them passively on. And then we're trying to jog. So when he goes out and does his first session, we put the cuffs on and he's just walking around with it. Can we decrease any kind of pain, any kind of feeling, get any kind of muscle activation that if we didn't have the cuffs on, well, we're better off than if we didn't have it on. And then each session, each day, he just felt better and better and better. And it's like, well, you still haven't got enough intensity to, we need some kind of cardiovascular work. So we put the cuffs on and we're riding a bike. Low intensity cardiovascular work has been shown in non-elite athletes to increase VO2 max and also strength levels as well. And I think in athletes, we're not increasing VO2 max, but we're potentially maintaining our fitness levels to a much better level than if we never had it on at all. And so consequently, this guy, you're training him hard. And I think you can attest to as well, is that when you're having athletes that do rehab, they're probably training harder than anyone else at that period of time. So you're just looking like, how can I maximize signaling pathways, anabolic hormonal responses? In terms of injury, it's this thing called immune cell recruitment. We need this recruitment of these immune cells to come in and help remove all the damaged fibers and help relay down our new muscle fibers. So all the processes around phagocytosis and, how can we encourage that more often and a little earlier? Because traditionally we can't stress the system with enough intensity because we're not using BFR.
It's interesting you say that too, Chris, because I think some people might have this preconceived idea if you've strained a muscle and you put blood flow restriction, it's going to cause more bleeding and inflammation into the tissue. But as you're suggesting there, it actually may accelerate perhaps that process as well, because we do need, although there's a very much an anti sort of inflammation belief, we do need some inflammation to provide the appropriate signals for tissue remodeling.
Yeah, and I think you see there's definitely some body of evidence about when you're injured, you got to move, and there's a temptation is that you're injured, you can't do anything. Whereas you got to be smart with how you're using it, of course. So the first couple of days, I wouldn't put the cuff on, especially if the cuff is going straight onto the point of the injury. So you give it a couple of days, but it's at the same time, it's like, well, although it's localized, it's still systemic within the body. And so we still, as I said, we can still train our arms, we can still train our good leg. Therefore, it's like from not hour number one, you want to give them a couple of hours just to sort out what's going on. But then it's just like, as soon as possible, it's like, well, let's start the process and let's look at what we can do.
As you alluded to, Chris, utilizing things like blood flow restriction for reducing things like tendon or joint pain. And I know there actually is some literature about the potential use of metabolic stress as a signal for, say, tendon and joint adaptations. Could you talk a little bit more about what we understand of using something like blood flow restriction to create metabolic stress for adaptation of connective tissue structures.
Yeah, there's not in my understanding, there's actually not a lot of evidence around the deep mechanisms as to the adaptations that respond to it. So it's probably not an area that I could go really into. There is,
Or even just talking about your clinical experience, your coaching experience with it too.
Yeah, so the big thing there in terms, especially when you have tendinopathies, is that you have pain and inhibition, and definitely with the pain, there's different opioid. There's an opioid receptor that gets activated, and there's two receptors that gets activated as a result of BFR training that relate to decreases in pain, and definitely I've found in people with tendinopathy is that it's just hard to get moving. It's just logical, and they're just sore all the time. So the advantages of the BFR is we can decrease the pain, and we still need to systematically increase the load though, but not as great amounts as traditionally. So then therefore we think about people who may not have access to huge amounts of load. They may not have access to a gym. So you might have someone who has a reoccurring tendinopathy, and then we take the work from Jill Cook and all those great people out there with the use of isometrics, and then I think about Alex Natira's run-specific isometrics. So using a tie-down strap, a little bit of a backpack, put the BFR cuffs on, and then we can actually be doing our isometric overcoming isometrics or our isometric pushing isometrics to be able to. The isometrics we know helps decreases the pain as well, but we're just maximizing the whole process, and then we're actually able to get some stress through the calves and through the Achilles. And listen to some other podcasts about just the frequency of training for tendons is really important. So then to say to the client, well, ideally do it as pain persists like paracetamol, but we need to be hitting this twice a day for a long period of time to really get that the adaptation in the tendons, because we know that takes a long time to create those adaptations. And if we don't have enough stimulus, well, my understanding is that we don't have enough stimulus longitudinally, is that we might decrease the pain, which is cool, but you haven't made the structural changes. And how are you going to get someone to do daily sessions when they say, well, I've got to go to the gym for this, so therefore this becomes the tool that they could take or they could have at home. Us as coaches and as practitioners, we can say, well, okay, we know it's hard to get a gym, so then let's use a backpack with some load. Let's do some long duration isometric holds, or let's do some overcoming isometric pushes using a tie down strap, nice little towel over the shoulder because it just might hurt their shoulder a little bit. But you could use it as a tool to complement the overriding thing that we're trying to do is that we still need a level of stimulus multiple times with those tendons.
Any other question to ask, John?
No. We always tend to ask our guests if there's anything that they're exploring that they're finding interesting that might be related to your professional work or your area of interest, but sometimes it's actually not, and it's just something that curious people like yourself tend to do is explore areas and learn something new. Is there anything that you're looking at the moment that's taking your interest?
Yeah, definitely. So if we want to talk non-BFR for a second.
Yeah,
absolutely.
Yeah, so Cedric's actually a wonderful case to talk about. And I've got all these little case studies that over time I'm going to actually write up. So we have this nice little story about training a decathlete. But in particular, he's an athlete that produces high levels of lactate. So when he's doing his lactic tolerance work or his 400-meter work, we're talking 20 plus mils per liter of lactate, and he struggles. So traditionally, we would be using, so you'd go, well, why aren't you using sodium bicarbonate? And as we know, some people struggle with their stomach on that, and he becomes more sick using sodium bicarbonate than not. So he just says, you know what? It is what it is. And look, there's some evidence around there's certain types of aerobic training that you could do to help tolerate that a little bit better. I just kept thinking, well, what else can I do? What else is there? And then I started going down this, started thinking about sodium bicarbonate, and there's this, people talk about having small doses, and there's old wives' tales about, my wife's granddad used to have a teaspoon of sodium bicarbonate and never got sick for his whole life. And then, so then that led me down to this road of looking at acidic and alkalinity of our body. Now, we measure that through, we can measure it several ways, but an easy way is through our urine using a pH meter. The higher our levels of urinary pH, the more alkaline our body is. Obviously, lower, the more acidic. And we want to be more alkaline than acidic. And there's some evidence around increasing alkalinity of athletes and the ability to tolerate high intensity workloads or high intensity training, which sparked my interest. Now, how do we increase the alkalinity of our body? There's several ways. Is you eat alkaline rich foods, a lot more veggies. If we have a lot of processed foods, cheeses and breads, that tends to give us a more acidic body. And therefore, other ways of doing that is green supplements has shown to, with some people, to increase alkalinity. And the other one is to drink alkaline water, which you can buy from your supermarket. And there's actually a couple of studies where they just bought supermarket high pH water where it's around, I think pH around 9, and not 9 to 10. And they actually showed once again in these studies that they were able to tolerate high intensity work. And I thought, well, we'll try a green supplement and we'll try alkaline water. And alkaline water actually tastes quite nice. I tried it myself. And we've got some lactates and we've got some subjective measures as well. And I wouldn't say that and it's always hard when you've got a case study of one, but I wouldn't say we have a huge p-value of less than 0.01 or 0.05. But definitely if we look at our effect sizes, if we definitely just look at how he can tolerate high intensity work, he would always be sick on these sessions. Saturday morning, he's there on the side and he's not doing too good. The onset of when he finishes the session and when he's sick has definitely increased. So he's able to tolerate the high intensity work. Sometimes he's not sick, but if he is, it takes him longer to get to that stage. And he bounces back a lot quicker. So rather than, the best one is when he does a 400 meters in a competition, he's holding his head like he's got this massive headache and it takes him ages to recover. And I've definitely noticed that he bounces back quicker from those really high intensity efforts, whereas opposed to let's wipe out the next 40 minutes. Within 20 minutes, he's up and around and he's bouncing. So
how do you implement those? Obviously the green foods is probably something that happens over time. And then the alkaline water, is it just something he drinks consistently now, or is it around the session, in the session, or in the competition phase, like in the actual competition itself?
Well, ideally,
how does that actually work?
No, well, you need, for any kind of intervention, you need it to be done longitudinally. And so he actually now, it's just become a lifestyle thing. It's expensive for him.
Just drinks
So if
alkaline water,
anyone's, just drinks alkaline. So if there's any sponsors out there want to help us out, give us a shout. But so it's an expensive hobby, but definitely I've seen a positive change, small change. But look at this level of an athlete, where that's what we're looking for. Yeah, we're looking for
small effect sizes can lead to big changes if you accumulate them.
Yeah, definitely. So that's
Chris,
really cool.
Thank you so much.
Simple. Yep. Sorry,
I think it's a bit of a delay, but thank you so much. We really appreciate you taking the time out of your day. We know how busy you are, so we very much appreciate you coming and sharing your expertise with us. It's been extremely informative, and we very, very much appreciate it. So thank you.
Thanks for your times, gents, and thanks for putting this podcast out there.